first I started off in March, and I went to see Dr. Williams, saw Miss Judy, and one of the things that I told her was my symptoms was I have pressure in my chest. And so after we got through talking, she said because I said pressure on my chest, she was obligated to set me up an appointment with a cardiologist.
Mrs. Bates came to see me sometime late last year, and she had a history of a cardiac catheterization 10 years, and she's been having some chest pain symptoms, and she was not sure about the results of her cardiac catheterization. She said they didn't find any major blockages at that time. So I felt, looking at her risk factors, that it'll be worthwhile at her age to do a calcium scoring. It's a new test that it's available to pretty much every patient above age 50. The hospital does a minimally invasive CT scan with very low radiation that specifically looks at the lungs, the center of your chest, and the calcium in your heart artery. So it basically can answer you the question whether you have plaque buildup in your arteries. And it's a great screening tool. And I did use on Donetta, and fortunately or unfortunately, we found that her calcium score was very high, which subsequently led me, because of her symptoms, to cardiac catheterization.
He said, there's two things that I can do for you. Either you can get a heart cath and check in there and see what's going on, or I can put you on some more medication. Well, I got tired of wondering about it, and so I just thought, I told him, I said, well, let's just get this done and over with. I'll go in for the heart cath. If there's something wrong with me, we'll get it fixed. If not, I can just go on. I was in the cath lab, and I was laying flat on the table, and I was looking to my left at the monitor. And every once in a while, I looked to my right and see Dr. Desiree. Then I'd look to my left again. And then I looked, and he was gone. And I looked further, and I saw the glass window where everybody had been and he was there on the phone. And I thought, something's really bad, or he's got a wife that won't leave him alone at work.
And when we did her angiogram, it shows that she had severe coronary artery disease. One of the main important blood vessel is what we call the LAD, and she had several blockages in that blood vessel, upstream, midstream, also downstream. That would require multiple stents to fix that blood vessel. Plus, her other blood vessels had severe blockages as well, again, multiple locations. So it would have required multiple stents to fix her. As a result, we entered into a discussion with her and trying to decide the best way to proceed. And after a long discussion with her and her family, she decided to undergo coronary artery bypass surgery rather than multi-vessel stenting.
He said, well, I'm going to set you up with a surgeon. So we was in there talking, had the curtains pulled, and we was talking about it all. And then all of a sudden, the curtains opened up, and Dr. Omni walked through, and he had a big, huge smile on his face, and he goes, hello, my name is Dr. Omni, and I heard you have a broken heart, and I'm here to fix it. Well, you can't help but grin, you know, and laugh.
Mrs. Bates was having daily episodes of angina, chest pain, lasting several minutes. And initially she thought maybe this was because of gastroesophageal reflux disease. I went and spoke to her about the operation and what was involved. And after talking to her, she went ahead and decided that was what she wanted to do.
Well, they're all standing there and they're looking at me, and I know they're as scared as I am. And they don't want to say anything like, bye, I love you, because, you know. And so it's hard it's hard because you don't know if you'll ever see them in this life again, you know.
She actually had 3-vessel bypass. Even though there were 2 arteries that were blocked, one of those arteries had a couple of branches coming off of it, and so I bypassed 2 arteries on the left side of her heart and 1 artery on the front side of the heart. And I did what's called a sequential bypass, where I kind of hit two birds with one stone, sewing the vein to both of those arteries, which provides a higher outflow so that graft has a better long-term patency, so it will stay open longer, and then use the mammary artery from the inside of the chest cavity to bypass the main artery on the front of the heart.
After you put your faith in God, that one way or the other, everything's going to be okay. Whether you made it or not, everything's going to be okay. I knew that. Then you have to put your faith in the medical staff to what? They're going to take care of you.
She did extremely well after her bypass surgery, spent a night in the intensive care unit, and was on the floor for several days and went home and has done really well since her surgery, and has had no further episodes of angina since then.
Oh, the staff here at United Regional is terrific. In the recovery room and intensive care, it was so nice, and the nurse that I had was so attentive. She was incredible. My husband kept complimenting her all the time. I didn't have to push my button for anything. They was constantly there, constantly taking care of me. After that, I've been all right ever since, and I feel like a new person. I totally forget that I've had it, and every once in a while it reminds me to calm down. It hadn't been that long, but I feel great. It's great. So I always thought that a heart attack was you clutch your chest, you have severe pain, you fall to the floor, And then I found out the symptoms of a woman and found out then that it's totally different from a man. And then I checked myself to where if I had those symptoms or not, and it was tightness of the chest, shortness of breath, pain in between my shoulders, in my upper stomach. So I just suggest that every woman takes time to look up the information and be aware of the symptoms. That way you can save your life and maybe somebody else's.